Hello and welcome to the Washington AHEC Scholars Podcast. My name is Jordan. I'm one of the instructors for the Washington AHEC Scholars Program. Today I'm joined by Charlotte Sanders, who works for the School of Social Work at the University of Washington. They're joining us today to talk about team skills. Welcome, Charlotte.
Thank you, Jordan.
How are you doing today?
I'm doing okay.
Good. So can you tell us a little bit about yourself, Charlotte, the work that you do, maybe some previous roles that led you to where you are today?
Sure. Well, currently, I work at the University of Washington School of Social Work. I'm the MSW program director, and I've held this appointment for the last couple of years. And I've been here at the school for about 11 years as a teaching faculty, currently an assistant teaching professor. And so most of my work now is really involved in sort of the infrastructure of what's supporting students within their academic experience here at the school, as well as getting to work with other health science departments. One of the things that I really am interested in and has been a great part of my practice has been in interprofessional practice and education. So.
That's perfect. That's one of the main things with AHEC Scholars is that offering that interprofessional education for, we have students who are physician students, nursing students. Let's get it started then. Why is the development of team skills and interprofessional collaboration an important part of the training for health profession students?
Well, definitely the team skills. If you were to think about any setting or environment that most health professionals are working in, you're not working alone. You're working alongside a lot of other people who have the same goal of providing care. But we do it in a bit differently, and we each have our own sort of perspective that we bring to care. And so this is kind of the way that we can be much more intentional around the training that healthcare professionals receive, that seeing this as part of your intent in going into healthcare, it's not just providing care to those we serve, but it's also how do we work with others
Mhm.
to provide that care.
Yeah.
And so I see it definitely as an important skill to develop and not something to be taken for granted.
One of the things that stands out to me is actually the last podcast we recorded was integration of behavioral health with primary care. And so, could you talk to a little bit just about like the history of social work working alongside medicine? Is that something that you have experience with trying to integrate the work that you do as a social worker or as a mental health clinician with primary care?
Yes. In fact, prior to joining the UW, I was part of a network here in Seattle. There is an organization called Neighbor Care Health,
Mm.
and they provide healthcare services within different neighborhoods within the greater Seattle area. And my role with that organization was as the youth clinic manager at the 45th Street Clinic. My practice has mostly been with working with young people experiencing homelessness or who were at risk and or street involved. The work there at Neighbor Care's 45th Street Clinic was not only as a youth clinic manager, so it had an administrative component, but I was also the on-site social worker and also practiced within our behavioral health services. Um, and that is probably one of the experiences that really has led me to really focusing attention, or at least my interests, in interprofessional education and practice because of the experience I had there. I was there for about 9 years. And not only as a service provider, but also as an administrator. So being able to lead the interprofessional team that we had here. And so with that experience, that definitely taught me a lot about how important it is to have an understanding of what everyone is bringing um, to the work that we do, that we all have a different perspective and understanding of what the needs are. And it can be extremely beneficial to have conversations together about what each of us are bringing or seeing from the patients that we serve that could possibly help to inform the practice that we provide. So, uh, yeah, I think that's probably one of the most critical
Hmm.
experiences I've ever had that has helped to inform how I really want to support students in their learning and how to prepare for the work ahead of them.
That kind of echoes a lot of what we have experienced here with AHEC scholars. Which kind of leads next into our next question, talking about kind of that elephant in the room of the hierarchy of medicine that exists. When we're talking about developing team skills, and then like you mentioned about really understanding what each person, what each role brings to the healthcare team. In your experience, how does hierarchy in medicine affect outcomes for both patients and providers? Like either from a negative perspective or even just some general things that you've noticed.
Well, the hierarchy in healthcare predates all of us. I mean, that's
Mhm.
just kind of the expectation. And it's the experience of a lot of people, even today, even knowing that this is sort of the system that's there. Some of the things that I can recall from my own practice experience is that sometimes hierarchy can interfere with the ability to communicate. And I think that if we're not paying attention to the way that we interact and the way that we include other perspectives in our decision making, it actually can be really have negative outcome for our patients. When you don't have an open and inclusive way of communicating, you're leaving out possibly detrimental information that may greatly impact the patient in a negative way. And so that's what comes to mind. The example I have is like when you include a social worker at the very end of care, you may not have the opportunity of knowing what the social worker is able to gather through their assessment and then their relationship building, or possibly the resources that they may have available or knowledge of. You're leaving that out of your treatment plan. You're leaving that out of possibly creating a better network for that patient early on. The experience I have had, as well as hearing from students or other clinicians in healthcare, is that they're usually seen, social workers are usually seen as sort of the fill in, like whatever gaps we have, let's ask the social worker to see if they have anything that they might be able to contribute. So it's often seen as sort of before discharge or after treatment plan has already been created. I feel like if there was more communication and inclusion of social work early on, it might actually help to better inform what happens in the exam room or in the other professional exchanges that they have with with the patients. Um, and I think that's sort of why I really reflect on my experience of being in a leadership position in the clinic, that my background in social work and my training actually helped to inform a lot of the shift and change of how we practice with patients early on in the patient experience, from how we structured our intake forms, on how we engaged with the patients early on within the waiting room, to really do even the assessment begins even before we have someone go back to the exam room, that we're able to pick up on certain conversations, or in our engagement with patients early on, we're able to inform a provider before they see the patient as to what they might need to pay attention to, or here's some additional information that may impact your visit today. Um, so I feel like there are a lot of opportunities in working alongside other professions that it would be helpful to think about more intentionally around how do we better provide care for the patient? What do patients need? Um, and what's their experience with providers? I think social work can really be instrumental in providing a much more sort of humanistic, patient-centered approach than I think maybe just waiting for us to be seen at the very end of someone's visit.
Yeah, that's a good point. That's what I was thinking as I was hearing you explain is like social workers are a good demonstration of like, I think just in general, we don't really fully understand the work of social workers and what they do. I didn't until I started working adjacent to the mental health field. And then like the pop culture idea you get is, somebody at a desk filling out papers and, they sign off on your so you can get your health benefits or whatever. And like that's the idea that we have culturally with the work that social workers do. But like, no, they're involved at every part of the process. They can even receive training to provide clinical psychotherapy. I didn't know that until like recently. Like they can even do clinical psychotherapy. So, like in your perfect world, how would a social worker be best integrated in a care team?
Oh, that's a beautiful question. I think the part that I found to be really interesting is that, so with my training in social work, um, even the training that I received to do group work has been extremely helpful in facilitating um, sort of the huddle or the meeting of providers together and being able to structure that in a way that everyone feels heard, everyone has sort of an understanding of each other's role. And I feel like that could possibly be another way that social work can be included is in just the process of how
Hmm.
we work together and being able to rely on the skills that social work bring. Um, so I feel like that might be a possibility. I think the other ways, how often do we get to, in within healthcare, we often refer to the warm handoff, but
Hmm.
we don't really see providers working hand in hand in the same moment or being able to um, sort of do an assessment or a conversation with someone while satisfying whatever need I have in documenting my engagement with the patient and the provider's need as well. I wonder how interesting that would be and how satisfying for the patient is to have their providers being on the same page and communicating together
Hmm.
um, without having to repeat what they've said to another person again. So it just makes me wonder, like how much more we can do to be efficient with patients,
Hmm.
as well as to show the patient that they have a team working together for them.
Yeah, that you would think that that would be so much like it would be obvious that that would lead to better patient outcomes, but there still is like this boxes that we keep having to force patients to work through. Even as simple as like you're saying, if they're getting discharged from primary care or from an inpatient setting, and then right there is the social worker to here's somebody who can help connect you with resources and stuff like that. Like that's kind of what we do right now, like in general, but even that process could be improved, let alone integrating at every step of the process, let alone just like, okay, here, you're done with me here. Go talk to the social worker and see what's available to you.
Yeah. And
Yeah.
I think for myself and having worked with a vulnerable population of youth, it was
Mhm.
extremely important for us to do more of the assessment of what their needs might be
Mhm.
prior to them even going in to see the provider, just so that we could
Yeah.
work on some of those resources so that by the time that they were done with the provider, they would be able to have a quick meeting, but also be given some tangible things that they
Mhm.
could pursue after their visit or that would be available to them after their visit. So I just think that for every setting, it's different. But I think this is sort of the conversation. It would be interesting to see a conversation of providers, thinking about what's the experience of the patient while we have them in our care.
Mhm.
How could we better support them in getting their questions answered or their needs met in the most efficient way while still um, working together as a team and supporting each other in the goals that we have and meeting the patient's needs.
Absolutely. Yeah, because at the end of the day, that's really what it's about is meeting our patients' needs, making sure that they're fully taken care of. So you mentioned earlier that you worked with neighbor care, where you worked in situations that did involve quite a bit of interprofessional collaboration. Could you tell us a little bit more about what that experience was like when it went really well to have that interprofessional collaboration? Maybe even mentioning some of the adjustments that the clinic operations had to make based on the things you were learning.
Yeah. So I think in reflecting back on the experience, one thing that we instituted when I first joined the clinic, it was very much everyone kind of had their own services with patients, and there wasn't a lot of communication. There was a lot of missed opportunity of sharing information that one provider might be learning that may be impacting the type of care that they may have needed, or that had not really been part of the assessment of another provider. And so the way that we addressed that was to make sure that we had communication both at the beginning of every clinic shift as well as at the end. And we call those sort of the pre-briefing of what is available to all of our patients that evening. And in this youth clinic, it was a bit different. They were held in the evenings and very specific start and end times during a few nights a week. And so it was actually really easy um, to schedule and to sort of create these times where we were able to do this pre-briefing. Everyone who's working within clinic that evening would come together. We would talk about the resources that were available that night, who was providing services or care, so that everyone knew who was on the team and what services they could be making a referral to in the moment that night. A lot of times we also use that time to share if there were concerns about we need to make sure that we follow up with this patient. It's, sort of the follow-up from the week before. We need to make sure that, if anyone engages this patient, make sure that we sort of fast track them to the exam room rather than having them wait. A lot of times we get to know patients, they would come week after week. And so getting to know your patients well enough to know that someone needs to check in with them, see if sort of what sort of mood or state they might be in, and what is the plan in case they need to be seen more quickly than waiting in the waiting room that actually increases their anxiety. So we do a lot of that planning at the beginning. And then at the end of the evening, we would do the debrief where we would talk about not only if there's anything that needs follow-up on patient care, and again, this is anyone who's available at the end of the evening from the team, what needs might need to be followed up during the next visit, what anything else that might need to be done during the week. Part of my role is also to follow up on any resources that we're low on or any referrals that people want me to look up and have available for the next time that the patient might be there. But it also gave the team a chance, and this is the other part where I don't know if we necessarily focus much attention on this as service providers to vulnerable populations, but we also made a space for people to talk about the impact of the work on them. And, how are you feeling about this evening? What went well? What needs improvement? Was there a process for that? Do we need to figure out what the process, a change in process so that it's less complicated or less stumbling along the way? Um, so that's kind of the improvement I think that was made based on our work together and along the way figuring out what do people need in order to do this work? What do you need from other team members in order for you to be able to have a good exchange or engagement with the patient? So I felt like it built a lot of cohesion among the team, better understanding of what each person brings to the work that we do together. I think it also built some compassion and empathy for each other when one person would have a really tough evening. We worked with young people who a lot of times were in crises, and be able to acknowledge that it was a really difficult night. What do you need? Um, and just providing the support to each other in knowing that they're not alone in the work that they're doing and the experience that they had, I think lends a lot to keeping up morale and hopefully warding off any sort of more burnout or fatigue that usually results in doing crisis work.
Okay, wow. You covered quite a bit there. I was impressed. Like first, you were talking about the patient outcomes and how it was better for them, and then you're talking like some of the practical benefits that came about because of it, and then also just honoring that it makes life easier for the people providing the care too, which that's going to be like this nice symbiotic circle that the whole process just improves, improves, improves because everybody's taken care of every step of the way. Did that give you the opportunity to work in settings or learn new skills and abilities that you probably wouldn't have otherwise had it not been for that integration?
I believe so. I think, as I mentioned, the training in any sort of group work, I think, has been really helpful in developing or transferring of facilitation skills to
Hmm.
not only that environment, to a lot of the other work that I did in community. Part of my work was also working with community partners and members, stakeholders, and again, helping to inform the practice and services we provided to these young people. I needed to be engaged in other community relationships that I knew what are the resources that are available to these young people? How do we support young people in connecting to those resources? So I feel like it really did help in that way in my work here at the school. Being part of the interprofessional education sort of core faculty, that experience helped to inform these are the things that we want students to be prepared for. Or if they were to imagine themselves in a work environment that's high stress, crisis, left and right, what would they need as a provider in order for them to sort of sustain themselves
Mm,
within this work? It can be very taxing. And I think the more that we can do intentionally around being aware of not only how trauma impacts the people that we serve, but also how it impacts us as service providers,
mhm.
really be helpful in sustain our own sustainability within the work, as well as the outcomes that we're hoping for from patients.
Okay, wow, fantastic. You talked about it a little bit, actually quite a bit. So this might be a redundant question, but you talked about like that strong team relationship forming out of that practice and then helping to providers to avoid burnout. Could you speak a little bit more about like some of the, like we talked about the practical benefits, but then like what did you notice about the people you're working with as they as this cohesion forms, as this like support and mutual help came about? Did that improve burnout with the workers? Did it keep to stay the same? What was the result there?
I think it was actually really helpful, and just thinking about the longevity of many of our providers. We had providers that had been working in the clinic for quite some time. Uh, we most of us choose different settings or different populations to serve based on our values and our sort of concern
Mm.
for community and humans. And so, thinking about the people who came to the clinic, um, I think it says something when you have people that have been there for like since it since the clinic began,
Mhm.
um, how long they commit towards doing this work. People wanting to, they get to some of our nursing assistants uh, would sign up for the shifts and they chose to work at youth clinic. So I think that's a sign that people wanted to be there, that they felt like this was a positive place to be. Considering the young people that we were providing care for, a lot of times it can be really difficult cases to be
Mhm.
witness to, difficult situations that they're in to be witness to. And so feel like it did help to create a very solid team of people that were there every week,
Mhm.
year after year. Um, so I believe that it does help. And when people feel like they are being cared for, not only patients, but also the people that you have on your team,
Mhm.
I think it also helps them to feel like this is difficult work, but I feel supported in doing it.
Yeah, kind of a trial by fire when you're doing some of the most emotionally difficult work. That if people are sticking around, then clearly what you're doing is working out for everyone.
Exactly.
Yeah. So can we like pull back a little bit and just talk about because the work that you were doing in that case, was that in a rural context, in an urban context?
Yeah, so that would be in a urban context.
Hmm.
It's here in Seattle, and a lot of the young people that we were serving, we're utilizing services within the Seattle area. Um, Prior to coming to Seattle, I also was part of sort of a medical mental health model, working in a more rural setting.
Hmm.
So prior to coming to the Seattle area in the early 90s, I'm from the Yakima
Oh,
Valley,
okay. Yeah.
more specifically Toppenish,
Hmm.
Washington. And after doing my undergraduate degree in psych, I went back to where I grew up in the community that I grew up in, working with Yakima Valley farmers, medical mental health.
Okay. Yeah.
Um, and so you probably are familiar because I know that there are a lot of AHEC um, students and scholars that are associated with many of the clinic systems
Hmm.
in that area. So yeah, and that was in sort of my experience of doing rural um, mental health care, but within a medical organization. And so working in partnership with not only with our psychiatrists and providing therapeutic services, but also working with the healthcare services that were there on site and kind of creating this wraparound team approach
Mm.
with the medical services that they were being provided and incorporating the mental health services. We worked a lot within not only the healthcare setting, but also within the school setting, the school systems, because that was the easiest way for us to engage, mostly working with young people.
The reason I was wanting to have that background is because one of the questions was just talking about the difference between working in a rural setting and an urban setting. AHEC scholars were particularly trying to promote our students when they graduate, either to think about working in either a rural or an urban underserved community, under-resourced community. And then, like you mentioned, we do, in fact, one of the AHECs in Washington is hosted by the PCA. So we do love to work and partner with our CHCs and FQHCs in Washington State. So yeah, could you just talk a little bit about what those differences are between a rural and an urban setting?
Yeah, definitely. My experience within in working in a rural setting and growing up in a more rural setting is that resources are much more scarce.
Mm.
And the way that we approach sort of meeting people's needs is a little bit different. You tend to rely much more on the relationships that you create within the community. And especially if you are part of that community, the relationships you have with patients can be a little bit different.
Mm.
Um, but that's probably the biggest noticeable difference that I can compare is the access to resources.
Mm.
Um, and I think this is where the intention setting around creating a team and getting to know the assets that you have in each other can be even more instrumental in meeting the needs of the patients that you have. Just knowing that you may not have the resources within your clinic or within the staff that you have, but when you're able to exchange like the needs that you're trying to recruit for or sort of this networking that occurs, someone else may have a contact that you can then add to your list of resources. And
Mm.
so this is where I think again having that communication of your team. A lot of times, and I was thinking about this, that usually the staff and the additional services or professions that are available in rural settings, those tend to be people who are sort of very stable. And usually it's our medical providers that sort of tend to rotate out depending on their level of education or where they are within their career. And so I recall sort of being the informant to a lot of medical providers that this is what we have available. And so our medical providers being able to ask questions and know who they have as resources within their team is extremely important because when there's a disconnect, then you're not able to really connect your patients to
Mhm.
the information that's needed. And so this isn't sort of that example of why it's so important to sort of see your team as that resource that you need in order for you to provide care. So they tend to be people who are from that community. They tend to be people who are well informed about resources. And so that was my experience
Mm.
of having been part of that Yakima Valley Farm Workers Clinic model, where we were able to really support the medical providers in knowing what was in the community and being able to make those referrals a little bit easier when they had sort of the the reliance on the resources that they had around them, which is part of their team.
Wow, yeah, that's I would think just from that practical standpoint of like maximizing that, like you're saying, if you're lower resource, then every little bit helps, or every little bit of connection you can make and just so from a practical perspective, it makes sense to have that integration. But then again, like the guiding star being that it's going to lead to better patient outcomes first and foremost, and then of course if the healthcare team is doing well, then that's also a great bonus. So, okay. Um, so, like I mentioned, we're trying to encourage our students to think about working in some of these settings in these communities. What would be some advice that we give to a student who is just starting out in their career? How they can begin to think about integrating team skills into their work, and even in or maybe especially in a setting where those systems don't already exist.
I think this is an interesting time for us as society where I think a lot of our sort of there was a we'll call it an interruption to maybe that sort of development of how to engage with people, how to talk, how to initiate conversation and become more social. And I feel like that's the advice I would give is that acknowledging that it could be difficult for people to engage and start a conversation, to initiate communicating with each other. And
Mm,
this is where noticing that it's a challenge for you and then being able to say, I think this is an area of growth for me that I would like to work on because this is going to help me become a better provider.
mm,
I feel like the expectation is, oh, just go out there and engage and start to connect with people. But I feel like, based on what we've been through as a society over the past 5 years or so, has kind of done some interrupting of people's ability to be sort of confident in initiating. So I feel like that the first step is the acknowledgement that it might be difficult to
mm,
engage. Um, and then after that, the recognition that I'm a student. Part of what I am doing right now is basically I just want to be that sponge and
mm,
I need to ask questions. I need to be able to reach out to people and learn more about what they do. I feel like this is an excellent opportunity as a student. If you acknowledge that about where you are developmentally, it's critical for you to be able to say, I would like to learn more about what you do. I would like to learn more about this setting or this environment. Culturally, I'd like to learn more about what happens here. Um, and also extending sort of grace to others when they're not able to necessarily offer you the information that you need right now, but developing and nurturing that relationship so that eventually you'll be able to get what you need in order to be able to inform your practice. I think that's the other part is, right now, I can't imagine what it's been like for students to enter into environments that are already feeling stretched. And, the people that are there to support their learning may not have as much time or availability as they would like to. Um, but it's important that you not give up on the first, I don't have time right now, or can we talk later? That you be persistent because
mm,
it's important for you to connect with those who are doing this work and be able to benefit from their experience.
mm,
And I think when people are asked about themselves and what brought them to this work, that might be a really good opening to having a conversation about learning what someone's experience has been. I think most people really do want to share of who they are and what they have to bring. And part of your conversation needs to acknowledge that you have an appreciation of what they have to offer
mm.
and you're very interested.
Yeah, one of the through lines I'm hearing as you're talking today is like that relationship building just being like a critical component to all of this. Like I think we tended to like I want to one, two, three steps to and how to implement these things. It's like no, sometimes it's just as simple as just talk to people, get to know them, get to hear their stories, form relationships, feel like you can reach out to them. One of our modules for the year two for AHEC scholars is about leadership skills, and it's like anybody can step up and try to be a leader, try to take on that responsibility. And again, like I say, it keeps always coming back to how do we improve the care that we're able to offer.
Exactly.
Yeah. Well, so we're running up on our time. I really appreciate you taking the time. Maybe one last question just to wrap up our discussion today. What excites you about the work that you do? Why did you get into this work? What's keeping you in this work of interdisciplinary education and collaboration?
Yeah, I just really enjoy teamwork. And I think that's probably what's really driven me to want to do, coming into social work, my motivator was really, the care for my community, the care for people, and what they are experiencing, and how might I be able to support them on their journey. Um, but really, the type of work that I'm doing now, or that I have done in practice, is just being in community with people and knowing
Mm,
that we're working on the same goal together can be a beautiful thing. It can be very difficult. Teamwork or group work isn't always smooth and easy, but the work that's done together, I think the outcomes can be so beautiful. Um, and you're not alone when you do this work. You have to acknowledge that I might have my area of expertise, but I benefit so greatly from the wisdom and knowledge of other people. And it makes me better.
A lot of really practical, not only like practical, but just like this is a process and it's something that you have to like commit to and you want to build those relationships and get to know people. So really enjoy your insights into this topic. Is there any last things you wanted to include? Anything I overlooked or forgot to ask you about?
I think so. Again, your question about how would we encourage people to sort of take these opportunities that they might not have thought about before. I think I've been in the sale area for quite some time, but I still have this desire to go back home because of the experience of working in small communities,
Mhm.
such a treasure for me. And so I would encourage your students to really think about every experience that they have, that's just something that's going to be informing how they are as a provider, how they are within practice. And so being really thoughtful around the experiences that they're having and how that really is part of who they are going to become. So
Yeah, I appreciate that insight. I'd like to think that we help contribute to a little bit of that here at AHEC. And like I mentioned, I've been really pleasantly surprised when I see some of our students interacting. The physicians, we always tend to think of doctors as being at the top of the healthcare hierarchy, but the ones we've worked with have been really humble and they come and they want to learn from all their fellow students. So it's really heartwarming to see that. So. Well, thanks so much, Charlotte, for your time today. Really appreciate that. I just have to ask, do you get to work with Dr. Gino Eisenberg very often?
I do.
Yeah.
I used to be his neighbor in the hallway. Now I
Okay.
don't get to see him as often, but yeah, I
Yeah.
do.
We've done quite a bit of work with him and Leo Morales for the
Mhm.
Latino Center for Health there with AHEC. So,
Yeah.
yeah, that's really cool. That's what another thing just related to our discussion today is like my time 2 or so years with AHEC. I see all these connections start to form, and that's like, oh, this person knows this person knows this person. So, like, I get to live it and see it every day about how those networks and relationships can form. So, very cool.
And I think that's the wonderful thing is that it's not that big of a world when you start to think about the relationships that are within it. I think
Yeah.
that's what connects us.
Yeah, absolutely.
Yeah.
Very good. Awesome. Well, thanks again, Charlotte, so much for your
Thank
time
you,
today.
Jordan.
Yeah,
Okay, thank you.
you got it.